Hello, everybody from Calgary, Canada. I'm in Alberta right now. I sound a little congested because I'm in Calgary, but that's not why. I didn't get to do our Wednesday lesson of the day, and I did an interview today earlier with the Miami Herald about a really cool procedure that was done in Toulouse, Francais, which was a nose transplant. And the young reporter was asking me if I'd heard about it, and I said yes, of course I had. It's a really interesting thing that happened. So a lady who had a sinonasal cancer, which means a cancer of the nose and the sinuses, had to have her nose removed. This is like 13 years ago or something, and had multiple treatments to try to reconstruct the nose, didn't work, and then tried to use prostheses, which are little fake noses, and add them on, and they weren't working well. So a surgeon over there decided to do a three-dimensional free flap transplant, which is the coolest thing ever, and I'll show you all what it looks like, just so you understand, and then the history of it. We'll see. So here you can see the picture on the left over there. That is an implant that we use for other types of things like chin implants and things like that, but they made a three-dimensional print where they actually made the framework for the nose, and what they did was formed a wrapping of this with the forearm skin and left it as a vascularized pedicle, so it actually has an artery and a vein to connect to. And this is cool, very, very cool, because let me get rid of that photo. I don't even know how to do this anymore. So very cool, because in the past, the only ways that we knew how to reconstruct the nose was to take skin from the forehead and bring it down, or bring the cheek and bring it around. But the difficult part of this was that you had to have three layers: the outer layer of skin, the inner layer of cartilage, and the inner lining of the nose, which is the mucosa. And this lady didn't have any of those. So there's no other real good way to reconstruct somebody like that who's failed all these other flaps. So what they did was take tissue from the forearm, form it around a three-dimensional model, and then took that after a few months that it had formed and transplanted it here with an artery and a vein connected so it could survive, because you can't just take skin from somewhere and put it somewhere else. The cool thing about this is, historically, when you look at plastic surgery back in like Egyptian times, maybe the first surgeries that we knew about that were plastic were nose jobs. So Middle Easterns, got the big noses. So they were doing rhinoplasty way back when. And then 1400s, 1500s, like Renaissance time, you have these other plastic surgeries for during wartime, where they were trying to reconstruct facial defects. And if you look at this photo over here, you can see that they would actually attach the arm to the face and leave it connected like that for a few months for the skin from here to attach to there, get its own new blood supply, then disconnect it. So you'll see a bunch of photos if you ever look this up. These were the initial free flap surgeries or plastic surgeries that were done in war, victims of war who had been hurt. And then Gillies, who was a very famous surgeon, came and did transposition flaps like this, which are really, really cool, tubular ones, regular ones. And still, these have been done for years and years and years, but the coolest thing about this is that they made a three-dimensional flap around a nose. Now, it's not going to be a pretty nose, but it's going to be a nose. And they inset it, artery and vein, had a nice new blood supply, and it seems like it survived so far. So I'm excited to see what other kind of models they come up with to use this for, because there are so many patients that are devastated that have no other options. And this is just like where the face transplant idea came from, where face transplantation was done. So very, very cool, novel technique using older ideas, but it's amazing. Lots of smart surgeons out there. I wish I were one of them, but kudos to those guys, and I think it's incredible. I'm very happy for that patient.